Hello everyone, welcome to SALVY'S World Podcast. I am Obo Salvation. Today we are going to talk on an interesting psychiatric topic, schizophrenia. So I have two guests here who are
Amechi Kindness.
Esther.
So I'm honored to have you here. Thank you so much for coming around. We'll be moving over to this topic, schizophrenia. I know many people might not actually know about it, so let's give them that awareness as health workers that we are. So we're going to look at the definition and epidemiology of this case, schizophrenia. So, Nurse Kindness, can you please help us to define schizophrenia?
The term schizophrenia is defined as a chronic psychotic disorder characterized by a disturbance in emotion, thinking, and overall functioning of an individual.
Wow.
It is also mainly seen during late adolescence and early adulthood.
Okay, that means when someone starts seeing things that are not true, it can also be referred to as this schizophrenia. Okay, thank you so much. Okay, so Mommy Kindness, please, will you like to tell us the conditions that are important in nursing practice about this schizophrenia? What conditions should we be looking at?
Conditions important to schizophrenia. As a nurse, I will say first, thank you for the opportunity to be part of your podcast. As a nurse, we should look towards educating our patient on this, because when we educate, we remove stigma.
Okay.
Then once the education is there and carried out, the education goes with the sensitization. So we sensitize their mind to know what schizo is, how it affects, So we look at to the behavioral pattern and behavioral changes of people around us, so that we'll be able to identify. So then we go to early identification. Because early identification helps in prompt treatment.
Yeah, sure.
Then I don't know if you've seen the latest research now for 2025 research. You find out that some mental illness, you can't go to go to all approach anymore. Now we have to go with a tailor-made approach, because some drugs and other things that some youth are doing right now. So we need to have them test them, the kind of drugs that we go with, because of resistance, in order to avoid schizophrenia.
That means you are trying to tell us that it's very, very important that a nurse should learn and know more about this schizophrenia, right?
Yes, because if you don't know it, you wouldn't know how to. Technical know-how helps causes death. To help us, we will have high mortality rates, can equally lead to high morbidity rates. So we need to know, we need to be grounded on a particular course of action, so that we will know how to treat it early. Just like the case of COVID-19, because we don't know much about it, we are going from test this one, don't eat this one. You hear people say don't eat a goosey soup, they say don't take orange when you take the injection. So but when we got to know how to go for the treatment, things change for the better.
Okay, thank you so much, ma'am. Really honored to have you here. Thank you for that exegesis on that. Okay, so now we're going to look at the clinical features or clinical manifestation of this case, schizophrenia. So, Nurse Kindness, can you please help us to say, like, let's say this is a student nurse that is about to write an exam or a OSCE, something like that, and is being questioned to tell us about the signs and symptoms that one should check about this case of schizophrenia. What are the things? Is there any way that you can summarize it for us so that we can be able to know the tips for this case of schizophrenia?
Okay, simply put, we can categorize these symptoms in three different ways.
Okay.
We have the positive symptoms, the negative, and the cognitive symptoms.
Wow.
Under the positive, this has to do with the attitude or behaviors such as disorganized speech by such a patient. Then under the negative, we find out that a schizophrenic patient has this kind of attitude like social withdrawal. They would not like to associate with others. Then under the cognitive symptoms, we have impaired functioning like loss of memory, lack of decision making. All these are symptoms that are visible in a schizophrenic patient, and they affect the general and overall well-being of social.
Wow. So that means we have the positive symptoms, we have the negative as well. So wow, this is interesting. Thank you so much for that explanation. We appreciate you. Okay, Nurse Calmness, please, is there any signs that one will be seeing in the ward? Like for now we are working in the ward and we have a patient. Is there any signs that we'll be seeing and we'll say, okay, let's observe this sign to see whether this case might be a schizophrenic case? Is there any sign like that?
Yes, for a schizophrenic patient now in the ward, we are looking at incoherent speech.
Okay.
The person will not be able to say something that you will be able to understand. The person might be saying something that you really do not understand.
Yeah, sure.
You might say a sentence that is quite, you were like, okay, I had this one. The next thing you hear is that
Sure. Making.
And I'll tell you that there's snake in your head.
Snake.
When there is no snake in your so like then very serious. I mean, like if somebody is making, so they have incoherent speech, they have poor hygiene, so you have to be the one to tell them to go on bed. Sometimes they might mess themselves up. So we have a non-adherence to treatment. This person that is acting like this, there's no way you tell them come and take your drugs, and the person will adhere to it because he has lost touch to reality. Okay, so they will look at social isolation because you have lost touch to reality. You won't be telling the person go to school, go to church, go to mosque, go and buy things in the market. We have functioning tomorrow. We have conference next tomorrow. The person doesn't have the capacity at that time, and you can't help the person people because the person is sick. So these are the things we look at to the patient and the ward, so that you're able to identify if this person is schizophrenic.
Wow. So student nurses and nurses out there, in case when you go for your clinicals or you are working in the ward and you start seeing these signs and symptoms that my amiable guest just listed out here, please start suspecting schizophrenia. And you can also help by telling, advise them to go and see a psychiatrist. I believe that would
I know
be...
psychiatric is mental health is a general health. And equally you can see this in your friends too.
I have them.
Individual.
I have them.
You just have to sit down and tell yourself. So that time I was saying that what was I actually thinking? You especially see much students during exam time. So you can start diagnosing your friends. You start from yourself, from your family.
Charity begins at
your family. You
Charity
start diagnosing. This my uncle actually has schizo. So it's actually schizo. It is schizo, my sister. So you start from the family to diagnose.
Thank you so much. So you watching us out there, start your own as well. Look at those signs and symptoms and know how to diagnose. Even yourself, diagnose yourself too. Okay, so now we're going to look at the etiology and the risk factors of this schizophrenia. So, Nurse Calmness, can you help us by telling us what can be a cause to this case of schizophrenia, please?
If I say that cause of if schizo is idiopathy, I might not really be wrong, but other research might have other things to say. Okay, but I hope you by my own explanation, you will be able to understand that schizo isn't just one man task force. It's a combined task force. So it is it is different factors joined together that causes schizophrenia. So now in my own aspect, I would say that it is caused by three main factors. So when we are looking at the gene, that's genetic factor, then we look at the chemical aspect, which is your brain, then we look equally at the environmental factor. So now if you come to genetic, you know genetic biology, your body makeup, okay? So now you look at your hereditary. Okay, so from me, I might be the person that wants to marry you, or you want to marry me. Anyhow it's supposed to be. No, they cannot hear schizo. So now it comes to be like one of the couple has a mutated gene. Okay, so now this thing now is genetically inside of you. It can be from the fourth generation or the third generation, something that is passed down. Okay, so maybe it has been there, but it has not been triggered.
Yes.
It is there in your system already. Okay, so now once it is there already, you know you did not eat some particular thing that caused it. It's there inside of you. Now once it's there, something will have to bring it out.
That means it has to be triggered.
Yeah, so it's like you have a wife you want to marry, she's already dead, but somebody will have to bring the person out to come to the altar. So now what is going to bring this person, what is going to trigger this person out? That is the environmental factor. Now this environmental factor can be poverty. Now this environmental factor can be heartbreak. Environmental factor can be losing a family relative. It can be being chased out of school. It can be a whole lot. It can be disaster. Okay, when there is flooding, it takes away, take away over your whole property and all that, so you lose something. So there's a lot of triggering factor out there. It can be from the environment you be trained. It can be smoking. It can be drinking. It can even be like taking cocaine, coffee. You know, it can be like too much studying as a student, right? And so it can be lack of sleep. You are watching movie for three days, like that season, you know that particular episode, I need to finish it, and you lack sleep, and your body really needs this thing, and all these things is going to your brain. It can be because of too much excitement. Yeah, so that excitement and the heartbeat goes towards the brain. That's we're looking at your brain mechanism, the dopamine and the glutamine. So now too much of all these things can trigger the thing that's already in your gene to come out, and it affects your brain for you to now have that wrong wiring in your brain. So that's my three factors that I think that can cause schizo.
Biologically,
yes,
can be problem for it.
Yes.
Then environmentally as well.
Yes.
And neurochemical.
Yes.
Thank you very much for that. At least if it's when you start living in this kind of environment, you can start checking these things out to know how it's going. Okay, now kindness, is there any misconception that nurses should avoid, whether nursing student or a nurse that is working in a hospital or a clinic? Is there some misconception that that person should avoid concerning a patient with the case of schizophrenia?
Of course, there are a lot of misconceptions about schizophrenia, and as we've heard earlier from my co-guest, she have talked about the causes of schizophrenia. So as a nurse, we should avoid this misconception that schizophrenia is a spiritual attack or as a result of a person's weakness. It's not. Schizophrenia is a medical condition that requires an evidence-based care. So these are things that a nurse should consider when managing a schizophrenic patient.
Wow, thank you so much for that. So schizo is not village people's work. It's something that has to do with neuro or a psychiatric patient. So people should, it's not when somebody starts behaving like this, it's like, when I go at church, this mindset of let's go to a church for spiritual parenting. Schizo is not a spiritual attack, it's a psychiatric issue that needs emergent psychiatric help. Okay, now let's look at the management and the nursing care of this schizophrenia. I would like you, Nurse Kindness, to tell us about how this schizophrenia can be managed.
We can manage schizophrenia in so many ways. Apart from antipsychotic drugs, we can also manage schizophrenia by therapy.
Okay.
Psychosocial therapy.
Wow.
When a therapist talks to a schizophrenic patient, that can help the person try to manage his or her lifestyle. Also, we have education and support.
Okay. Yeah.
You know, when someone finds his or herself in such situation, they might be confused about it. So it's left for the nurse to educate the person about his or her condition and ways to manage it.
Wow. That's nice. That's nice. I believe, especially that education, people that are suffering from it needs to be educated.
Know more about their
Yes,
condition.
even the family members as well need to be educated so that they will know how to handle and live with such a patient or a client, rather. Okay, so now, nurse Calmness, I would like you to tell us the role of a nurse in treating this case. What are the roles that the nurse should play in the life of a schizophrenic patient?
Okay, thank you. You see, nurses play a vital role in the treatment of schizo, or a lot of vital role actually. So the number one role they play is health education.
Okay.
Now, just like the other guest said, we health educate the family relative. But I think we should start this health education from onset. Okay, when we have when we go out for health talk, for community mobilization, where we should have this information passed down in the communities so that people will know that if something like this happens, nobody casts madness on somebody. It's not because you are dragging land with somebody. It's not because God hates you. It's not because Annie is pursuing you.
Exactly.
It's not because of whatever deity or whatever you're worshiping wants to strike you mad.
Exactly.
Okay, so we should be able to understand that it's a particular reaction to miswiring in the brain.
Okay.
So now that we've talked about this health education, we should help educate the family relative, because before they come to the hospital, they might have gone to other nominal hospitals, the general hospitals, the other hospitals, before they will refer to psychiatric hospital. So they might be in denial stage. They say, no, my son is not mad. No, that stage.
Yeah.
Okay, so they will have to how to educate them, reassure them, counsel them. Okay, so after this, you now have to encourage them, because maybe the patient might not continuously be in the hospital, say for a particular time. So when the person, we have to encourage them for drug adherence.
Even to avoid this stigmatization of the
Yes. So when you encourage them for drug adherence, now when they start taking their drug, they start coming back to reality, because the reality was altered. Okay, then you have to promote personal hygiene. Okay, so nurses will have to find a way help their client to bathe even when they go home. Okay, so you have to tell them about peer pressure, how to associate with these peers, this thing. They will now look at the stigmatization aspect. Even we nurses, we should look into stigmatizing our patients, right? So you might say, now this particular one is very, very aggressive. No, I'm not going to give you. You're like, this governor's son is actually mad. So a little thing you will snap. So I think even videography, snapping picture in this kind of special hospital,
that invasion of privacy,
should not be encouraged, because it might be let me take a moment of selfie, you snap somebody's son that is not supposed to, because of our role in confidentiality and privacy. So all these things nurses need to work extra mile in protecting their own patient privacy and confidentiality, and then warding off stigma, talking to the family, counseling them, bringing them, even doing the psychotherapy aspect. Some other person might be going through heartbreak. Maybe psychotherapy would make the person to see that there are a lot of fishes in the sea. You just need to change environment. You just need to change your lifestyle. Then talk about lifestyle again. Stop smoking. Stop drug abusing. All this kind of lifestyle that might prompt you to having schizo. So those are the things more things that nurses need to do in curbing of schizophrenia.
Wow.
Thank you.
This is amazing. That means we nurses, we have an active role to play here. We have an active role to play. Okay, since we have been talking about, you mentioned about stigmatization as time goes on. I think we need to look at stigma, safety, and professional attitude now. So, Nurse Kindness, can you please tell us, this schizophrenic patient, are they dangerous as people used to think? You know, when we start seeing people that are having these mental cases, we used to have this perception in us that they are actually dangerous, we should avoid them. These schizophrenic patients, are they dangerous?
A good number of schizophrenic patients are not violent. So it is the duty of a nurse to nurse these patients with empathy.
Okay.
Because when you do, the patient feel relaxed. They also come to understand that we are not avoiding them, that they are still part of us. So when nursing such a patient, it is the duty of a nurse to nurse with empathy, professionalism, and non-judgmental attitude.
Wow.
Doing this will help these patients accept treatment and also have a mindset of getting better.
Wow. That means actually the schizophrenic patients are not harmful, they are not dangerous. It's just that you need to understand them, you need to study them and know how to interact with them. Okay, Nurse Calmness, is there any way that nurses can help to reduce this issue of stigmatization?
Yes, actually, I think we are one of the people that is in the forefront. Will I say forefront? We are the fronters in this stuff, so we can. I think one of the ways we should reduce stigmatization to not only schizophrenic patients or any of a mentally ill patient is by encouraging people to go for mental health checkup.
Yes.
Just like I do go to check my teeth, to wash my teeth, to check my eyes, to check my blood pressure.
Yeah.
We should encourage people to take time off, go to a mental health clinic, go to a psychiatric clinic, go and do aware assessment to know how good you are, if you are available for this, if there are things you should avoid, just like you have hypertension, things to avoid and all those stuff. You understand? Now, this stigma too, we should start it from avoiding. We could start from premarital counseling.
Exactly.
Okay. So when you are waiting to get married, you go to the hospital, you should be able to check if this person can stand the pressure. When we are writing CV to look for work, you say I can work under pressure. I cannot work under pressure.
I used to write it down.
Yeah. So all those kind of things, there are people that can work under pressure. So you should know the level of pressure this particular person should be able to bear. Okay, so now we'll talk about health education. We can health educate the public, the masses, just like we've been doing now. That schizophrenia is not a weapon formed against you.
Exactly.
It's a reaction to a particular thing happening inside of you. It's a reaction to something you came to this world with. It's a reaction to something that has been before you. The only thing you could do is to manage it or avoid it and avoid the triggering factor. Okay? So we can equally avoid stigmatization by using a good language in the clinic. You don't say this one is a mad person. No, they are your clients. They are your clients, so you should give them respect. Give them respect as clients because you were there for them. Without them, you wouldn't have the work you're doing.
Exactly.
Your profession will go to an extent.
Exactly.
So you should see them as a VIP. They are your VIPs.
Exactly.
Give them the respect, afford them the respect they need. Care for them like empathy, she said. Give them that empathy they need. Give them their medication at the right time. You shouldn't be stealing their medication to go and play somebody outside.
No, that's a bad character.
Now you now snap them and post. If you see somebody like this, you know you are stigmatized. You know that you are schizophrenic. You are mad.
You're not a good nurse.
Yes, you're not a good nurse. So, then talk to the family relatives.
Exactly.
Let them know that it is not Mr. Ikechukwu that is killing your son. It can be effect of lifestyle. It can be that your son went to high institution and decided to leave. He decided to step out of his comfort zone and he entered it by force. You see that a whole number of people that have these things are youths.
is mostly used.
So you have to look at their lifestyle, their friends. So these are the way. Now when you find out these things, you don't just call them out, like calling somebody out culture. You say Joan is crazy, he's running mad. Okay, so
that shouldn't be hard.
We remove the bad languages.
Yeah.
We stop videographing them. We give them the right drugs at the right time. Then we encourage family and counsel them. We bring out the health organization, allow people to go for mental assessment on time. It will make everybody to understand that in one way or the other, we are sick, according to the definition of WHO, but we have to find a way to manage ourselves and live healthy to do our daily activities.
Wow, thank you so much. In fact, I must say that we have the best guest here. You guys have really done justice to this issue of schizophrenia. Okay, now, is there any final words that you would like to drop for our audience? Maybe the students, nurses that will be watching, or anybody that will come into this channel to watch this video. Is there any advice that you can give to the person?
Okay, so I would say that to all the student nurses that would like to major in psychiatric nursing, and to all our mamas and daddies in the psychiatric hospital that is helping to take care of our special people there, I want to especially thank you because you're a special person. It takes somebody with a special heart and a lot of empathy to step into the life of another person that has an altered reality. Somebody that you say it is born in there, don't go there, and the person will want to walk in there. So you have to take the extra care to move into the fire and drag the person out. I want to thank you, and I want to let you know that you're a special person and you are a bridge. You're a bridge to somebody's reality. Without you, even the drugs might not really work as it is, because emotional assistance helps to bring our loved ones back. So I want to especially thank you, and to our patient or patient relative that might be seeing this, I want to let you know that schizophrenia can be managed and the person can equally enter into workforce and live a normal lifestyle.
Exactly.
So brace yourself, go to the mental health, check yourself, take your medications, and live well. Avoid some lifestyles that don't conform to your own health style. And you're a special person. I want to celebrate you today and forever. Stay cool.
Wow, thank you so much. Our nurse Kindness, is there anything that you would like to tell, any word of advice that you would like to tell our audience?
Of course, you said a lot about schizophrenia, but there are just a little things I want to add. Having had how and symptoms of schizophrenia, we can say that early detection is important, and also a consistent nursing care can help improve the quality of life of a schizophrenic patient.
Yeah, that's true.
So when we notice anything, do not hesitate to visit a nearby hospital or a mental hospital to know exactly what is wrong with you. Do not conclude that it is a spiritual attack or village people, something like that.
Exactly.
Just be sure about yourself.
Wow.
Thank you.
Thank you so much. Thank you, my amiable guest. I'm delighted to have you here. So me too, I would like to tell the audience that they should always remember to treat the patient and not the diagnosis alone. It is very important to treat the patient and not just to treat the diagnosis alone. So please, in case you are following this channel for the first time, do well to hit the follow button, hit the notification, subscribe, share, comment, and we'll see you again next week. Thank you very much. I remain your honorable host, Nurse Obo Salvation. Thank you.